Hi,
Hello, Dr. Burns. How are you today?
I'm doing well. How are you?
I am wonderful. Thank you for being here with us today on Aspire Medicine. And thank you for taking the time out of your schedule to go live with us about the coronavirus in our community. And kind of need to back up a little bit today to tell the people about Aspire Medicine, Aspire Med. Aspire Med is a program that I founded a few years back as I started my pre-med journey to become a physician. And so on with the program, we actually have physicians to go into schools, give talks on their careers and how to become physicians and how important it is for minority children and people to see people that represent them in medicine so that they can, gain the information that they need to become physicians as well across the board or just be a worker in the healthcare field if they don't desire to become a physician. So we just basically try to expose minorities to all of the different careers within the healthcare system. So, Dr. Burns, could you please explain to us what the coronavirus is?
Yes, COVID, which is stands for the Coronavirus Disease 2019. It is it originated in China when we first saw the cases, but it was in animals then. Now we're
Mhm.
starting to see it in people, and that's why they call it a novel virus because it's new to us. We haven't quite seen it, and research is still developing. We still don't know a lot of what's going on, but what we do know is that this virus belongs to a family of viruses that are shaped like a crown. That's where you get the name corona. That's what it looks like under a microscope. And what we know is that it's caused by respiratory droplets. So whenever you're within 6 feet of someone who may be infected with the virus, if they cough, they sneeze, they talk, those particles are shed uh, when they talk and it could land on you. That's why masks are very important. As I said, this virus is still evolving, so it's a lot that we don't know. That's why it's important to protect ourselves. Currently, there's no cure, there's no vaccine. Now, the symptoms, usually someone will complain of cough, fever, shortness of breath. Whenever you're exposed to someone who's been infected, you have 2 to 14 days after that when you can start seeing symptoms. Adults that are over the age of 65 are vulnerable. Those with problems with their immune function, such as HIV, AIDS, those taking cancer drugs, their immune system doesn't work, they could be exposed as well. Also, what we're seeing is people who have pre-existing lung conditions, heart conditions, diabetes, high blood pressure, obesity, all of them puts them at risk for getting infected with this virus. Cough, shortness of breath, fever, those are usually the symptoms. But what we're seeing now is that some people will go to the hospital. They may have a mild headache. They may have dizziness. They may have confusion. Any of these symptoms are very non-specific, but they're also testing positive for the coronavirus as well. So I encourage anyone who may not feel well to get tested. You never know what you're dealing with. And also, this is very important. People think just because they're not sick or they feel fine that they cannot be infected. And that's further from the truth. I need people to
Right,
really protect themselves.
right. Okay. And with the evolution of the virus, because viruses they can mutate and, things can be added to that. What do you think we should do to continue to protect ourselves? Um, there's been a lot, said because of, different strains popping up and mutations and things of that nature. What do you think we should do to protect ourselves from the virus?
Okay. Well, like I said, mainly the mode of action of spread is through respiratory droplets. That's why we need to wear masks at all times when you're going out in public. If you can't avoid staying at home, try to stay at least 6 feet from someone because it has been proven if you stay 6 feet away, the virus will land somewhere else and not on you. We don't want the virus to get
Mhm.
on us. Hand washing is so very, very important because the virus can survive on surfaces for a period of about a week or so. So you need to frequently disinfect your home, disinfect your car. As someone brought up about wearing gloves in public. The only problem with that is if you wear the same gloves to the grocery store that you then go to the gas station and then you
Yes.
go to someone's house, then you're cross contaminating the gloves. So it's better that you discard the gloves after each place you visit. So we just have to continue to protect ourselves. And like I said, the virus is constantly evolving. We don't know what's going on. So until we get a handle on what's going on, it's always important to protect ourselves.
Okay, that is great information because I have seen people take the same gloves that they picked up their grocery with, went open, got out the car, went in the grocery store, got everything, bagged it, and drive home in the same gloves. They don't,
Right.
dispose of the gloves. They take those same gloves to the steering wheel, again, open the door and going back in their homes. And but they think that they're safe. And so you're saying that it's not wise to do that.
No,
Correct.
not at all. I mean, unless you have, we have a shortage of gloves right now. So
Oh,
unless you're
wow.
able to, get the gloves, take them off when you go one place and put another one back on, it's just better to not wear them and just frequently, carry some sanitizer and wash and sanitize your hands. That's actually a better solution than wearing the gloves because you're cross-contaminating everything.
Okay, gotcha. And also, you mentioned masks. Could you tell us the type of mask or what we should use to be covering our faces and noses?
Well, the N95 masks are the best kind, but those are only available to healthcare workers. They're not for use of the general public. But what you can get are the surgical mask, and this is one like this, or you can use a cloth mask. Now, for the surgical mask, if you're going to have to reuse it, I'm going to show you how to reuse it. But technically, these are only supposed to be used one time and discarded. But like I said, most people don't have access to masks. They have to reuse the same one. So when you use the mask, you want to make sure that when you put it on your face, your nose and your mouth are covered like this. So this is incorrect. That's incorrect. I've even seen people that went in the store like this. Now, what good is that going to do? So you want to make sure that everything is covered like so.
Okay.
And then when you get ready to take it off like this, and then close the inside of it, because this inside part is the sterile part. That's the part that touches your face. So this should never be exposed to the outside like this if you have to reuse it.
I've been guilty of not wearing a mask sometimes because I just think that I got to go and purchase this item before it gets too late, and I get in the store and it's like, oh God, I don't have my mask on. So I think we all need to be cognizant of the action that we're taking, to prevent this virus from spreading to other people. So moving to the comorbidities of the African American race, as well as all the other minority races. Normally, the highest death rate of African Americans is heart disease. But right now, it's the novel coronavirus, COVID-19. So could you explain to us why we're at such a great risk right now?
Okay, well, let me just tell you this. As far as whether COVID-19 affects Black people more, that's not true.
Mhm.
COVID-19 does not discriminate against race, against gender, against anything. Anyone can get it. But the problem with the African American community is that we usually have poor diets. We don't eat what we're supposed to eat. Also, we have less access to recreational facilities, so we don't exercise, and exercise has been known to boost your immunity. Also, a problem in the African American community is we don't have the health care we're supposed to have. So we can't go to the doctor and get treated as someone else who might have adequate health care. Lack of insurance is a major problem. And I feel like there have been cases where a Black person may have gone to the hospital, gone to the doctor, and the doctor dismissed his or her symptoms and said, well, you're not really that sick. Go home. You'll get better. And then they end up having the coronavirus and they don't fare as well because they didn't get the treatment when they needed to get it. Also, there was a study I looked at that where Black men are being targeted for looking guilty. So when you have a Black man walking down the street with a mask on, people think, he might not be, that goes back to the incident we had with the Black man who was killed jogging in his neighborhood because he looked suspicious. Well, a Black man walking down the street with the mask on, some people may feel, he's suspicious. And so that makes him self-conscious and not want to wear the mask. So there have been a lot of things that, disproportionately affect minorities and Black people in particular.
Okay. So
and also another thing I'm sorry, go ahead.
Go ahead. No, I was just going to just say we need to cut down the heart disease by eating right, exercising, the sugar intake,
Yes.
being diabetics and things. Because in our culture, we're great cooks. We love to eat, and
Right.
we gather with our families and everything and have these great big meals, but we have to be mindful of the things that we're eating so that when certain viruses or certain illnesses become prevalent within our community, we won't be so susceptible to those things. But go ahead and finish your comment.
And I just wanted to say that the more pigmented you are, the less vitamin D that your skin is able to make. So Black people need to take supplements of vitamin D because they can't make it within their own bodies because of the pigment in their skin. That's been important in fighting disease. There have been cases where patients who had deficiencies in vitamin D didn't fare as well as those who had vitamin D. Also, vitamin C is very important. Like I said, exercise, rest, going outside, keeping active, keeping your mind active so you don't, get bored. These are all very important things to stay healthy.
Awesome. Um, and before we go, Dr. Burns, could you please share with us some of the testing sites where I completely forgot to do the photo?
That's okay. Mayor Mayo has gotten some free testing. So for those of you that don't have insurance or can't afford to pay, there are some sites throughout Northeast Louisiana. I posted the sites on my Facebook page, but there are various times that you can go to receive a free test. It's mobile. You don't even have to get out your car. They come. You stick the swab down your nose. It takes less than 5 minutes and you're on your way. But I want everyone who think they may have been exposed or who may be sick to get a test. It's free. Take advantage. You don't need any money. It's free. It's free. It's free. There's no excuse. I don't want people to live with their head under the sand because denial never helps anything. So the only way to get better, you got to go to the doctor. And I want to encourage everyone to stay positive throughout this experience. Stay informed. Stay safe. Listen to Governor John Bel Edwards. He provides excellent Facebook live press conferences where he goes over what's going on in the state. You need to stay informed. Don't be afraid. Coronavirus is not a death sentence. Even though a lot of people are dying, I want to stress that there are more people who actually recover from this virus than the opposite trend. So I don't want people to feel be in fear. Be cautious, but don't be fearful.
Yes, today I was reading the numbers, and Katie Couric in her news session, she posted that over 1.9 million people have actually recovered from COVID,
Right.
and globally, worldwide, not just the United States, but globally, that's still a plus.
Yes.
I'm scrolling. So while I'm scrolling, Dr. Burns, is there any last comments you want to make pertaining to the virus, what you think the people should do in the future, how to move forward, from the virus without panicking? And is there any?
Yes, like I said, panic does not, do anybody any favors. I want everyone to stay grounded, love on your family, just stay positive. A positive mindset is what's going to get us through this pandemic because we're all in this together. There's not been one single person that has not been affected by this virus. Stay informed. Just because you can't see, someone in person doesn't mean you can't get on social media or talk on the phone. That's what it's for. You just have to stay connected. If you want to find out more information as it evolves, you can follow the Centers for Disease Control and Prevention. Their website is www.cdc.gov. Also, you can find updates at the World Health Organization, and their website is www.who.int.